It's interesting that you say geriatrics because I remember we've had this discussion before. In fact, one of my first encounters with Zaid, because I think me and you met him differently. I saw you in the team, but we hadn't formally spoke. When we first spoke, I don't know if you remember, it was in the mess, it was in the junior doctor's mess. And Zaid he was banging on about why geriatrics is important, and you know, like the importance of doing geriatrics, and how a lot of people, when they first see you as a medical registrar and you say to them, yeah, I want to do geriatrics and I want to pursue that as a career, they're like, why would you do that? I think you mentioned somebody, in fact, you can go on to tell us later on, but which we'll touch upon, but somebody in fact told you, why would you waste your talent, or something along those lines, like why would you waste your talent doing that? Which is very sad, to be fair, because I'm doing geriatrics placement now and I love it.
Yeah.
Honestly, like it's very holistic.
Yeah, it's very holistic. It's very rewarding, and I think being a doctor, you know, I would expect anyone to be compassionate, and you know, older people are just older people, and you know, they tend to be more vulnerable and may have more dependencies on people, and therefore, you know, it's very sad when we look at that as a specialty. Like, who would want to do that? You know, these people need looking after, and actually looking after older people makes up the vast majority of what modern medicine is. And, you know, if that's not something that you aspire to do and want to do, then you're in the wrong profession, is my view. But, yeah, it's, you know, if you're not passionate about something as a doctor, a specific specialty, it doesn't have to be a specific specialty, but if you're not passionate about looking after and getting people better, then you shouldn't be a doctor. Now, to be fair, you may have those views about geriatrics, but that may just be because you want to do pediatrics, or it's just not for you. But yeah, I think all doctors should, you know, at least enjoy looking after older people, because that's a big part of what medicine is these days. We're all aging. This is an aging population. And, you know, I would expect someone who wants to be a doctor to be compassionate enough to want to look after older people anyway, but I digress.
Yeah, no, it's important. I agree. And I feel like it's a specialty that I feel like even in medicine, like as you're training as an undergrad in medical school, you don't get enough of. I don't remember, I think I had like 2 weeks in 5 years medical school. I think I had like 2 weeks placement on geriatrics. But if you look at it, like, for example, if you want to be a GP, you're going to see 90% of your patients are going to be geriatric patients, right? You're going to see a
lot of them, vast proportion, yeah,
exactly. So I feel like it's very, very important, as you mentioned, because it's an aging population. And also, for me, to be fair, having done, my first rotation was obviously acute medicine, both of us. Then I was on general surgery, and now I'm on a geriatrics placement. In terms of like even the feeling you get, how rewarding it is, I don't know. Like I feel like there's a stark difference compared to the other specialties. I don't know. I don't know if you've seen that.
Just to think about it logically, as in picture the actual situation, okay? All of these elderly people are loved ones for someone, you know, someone who's had an abundance of great memories with people, their families, and they're in hospital. And, you know, their families would love for them to be with someone who's compassionate to them, looking after them, and goes the extra mile, you know, to really take care of them, rather than kind of neglecting them and not taking their full needs into consideration.
Yeah, no, for sure. I mean, I think this is a relatively ageist country. I think people just struggle with the idea of losing their dependence and becoming disabled. And I think because in this country, I think we have, I wouldn't say weak family values, I'd say, you know, less strong family values when it comes to, you know, maintaining strong and close relationships with your older, you know, relatives. I think a lot of people gain their independence quite early in this country and move out of home, and you know, they live separate lives to their parents, and I guess as they get older they grow further apart. And I think that's a big part of why I like geriatrics so much, because a lot of these people are very isolated, and I personally feel a lot of social isolation, you know, as a male, but just, you know, with mental health problems, I guess. And so I think I'd probably see myself in their shoes a lot, and I know how difficult it would be to be in their situation. And so it's nice to look after them and sort of advocate for them in that way. But yeah, I would really recommend geriatrics to anyone. But I think the main reason it's not talked about much in med school is because there are specific conditions that are more common and more, you know, difficult to deal with as an older person, i.e., you know, confusion and dementia, incontinence, falls, things like that. But the reality of what geriatric medicine is actually very, very complex medicine, where you're trying to weigh up, you know, a best interest decision for someone how far should you push to investigate a certain condition if you're not able to treat it? Because the treatment may be too aggressive and the outcomes for the patient wouldn't necessarily make the treatment worthwhile, when actually the longer they spend in hospital, you know, the more deconditioned or weak they become from not getting about and walking and stuff. So it's actually very complex, and older patients don't present the same way as younger patients, and often they may have confusion due to dementia or delirium, for example, and may not be able to express themselves, and it's a lot harder to work out what's going on. And I'd say geriatric medicine is a huge grey area when you come to treating these patients, where you're not really sure what you're doing. There's a lot of trial and error, but you know, as time goes on and the patient stayed in longer and it's been less mobile and whatnot, and they become more and more weak, you know, you're just fighting this battle of trying to get them out of hospital, but at the same time knowing that they need to be there in some ways. And it's a very challenging job, but in many ways, that's what makes it rewarding.